Last time, we are doing clinical healthcare management. That is T303. Last time we did the introductory aspect of it. We talk about clinical management as a means, that is the program that apply to the system, science, incentives, and information to improve medical practice and assist both consumer and their support system to become engaged in a collaborative process design to manage medical, social, behavioral health condition more effectively. That is the introductory aspect of our clinical management, as we discussed last lecture. So today we are going to planning. We are going to health planning. What is health planning? What is health planning all about? So let's briefly look at this simple explanation. So from there, we'll be able to deduce what is health planning. Health planning is the process of divining community problems, identifying needs and resources, establishing priority goals, and setting out of the administrative action required to reach those goals. You know, from our introductory aspect, we said clinical health planning, clinical healthcare management, is is a kind of managerial activities being conducted by the management of the industry to make sure that there is improvement in medical practice, and at the same time assisting both consumer and their support system to become engaged in a collaborative process designed to manage the medical profession. So going from that, you'll be able to now relate that to health planning. This is the planning aspect of it. And at the end of the day, you'll be able to understand, okay, who actually is planning? Why are they planning? What are they planning for? So these are some of the things you need to really identify. So we are not talking about health planning itself. Health planning is the process of defining community problems, identifying needs and resources, establishing priority goals, and setting out of the administrative action required to reach those goals. That is just the simple definition of health planning. Now say types of health planning. There are two types of health planning commonly used in the health sector. That is strategic planning and operational planning. Strategic planning is the first one. This involves creating objectives and setting goals for where the company would like to go in the future, and then constructing a plan to achieve these activities. In a hospital setting, healthcare planning must be taken into account. That is, we must take into account potential government changes, technological advancements, and economic trends that could change the organization operation in a significant way. That is, in a normal hospital setting,
Mr. Falabi, please continue. You are not muted. Mr. Falabi, we cannot hear you. Please reconnect to your phone, log in, log out and log in again, please. Mr. Falabi, we cannot hear you again. Please log out of your phone and log in again. You only have a few minutes more, please. Mr. Falabi, please unmute yourself.
Hello, can you hear me?
Yes, I can hear you. Please reduce the volume of your system. I can hear you.
Okay, thank you.
Please reduce the volume of your laptop.
Okay. So we are talking of the two types of planning, that is strategic planning and operational planning. Strategic planning, this involves creating objective and setting goals for where the company would like to go in the future, and then constructing a plan to achieve this objective. In a hospital setting, healthcare planning must take into account potential government changes, technological advancement, and economic trends that will that could change the organization operation in a significant way. The importance of strategic planning in healthcare management should not go unnoticed by any healthcare system or hospital, bearing it in mind to succeed not only in short term but in a long term goal. A key factor that should be the basis of strategic planning in healthcare organization or in the organization of the institution, that is understanding the organization of the institution and how this organization is necessary for the entire system to succeed. is very important in creating an effective plan with specific strategies. However, sometimes re-evaluating who controls which aspect of the business, the beneficiary, having a solid foundation in which the organization is built upon is very, very important. And ideas can flow freely while implementing strategic healthcare planning. Basically, designing company goals and a path to achieve these objectives allows staff at every level, from administrators to physicians, to have a drive and passion that is extremely important in medical field. So we now go to some of the benefit of strategic planning. I said earlier on that we have two types of planning: strategic planning and operational planning. So we discussed little about strategic planning. So what are the benefits of strategic planning? The benefits of strategic planning in healthcare are numerous, because healthcare planning is composed of many components. Like most businesses, hospital and healthcare institutions are operating at many levels: patient care to financing, health system need to planning for future, in more ways than one. Strategic planning takes into account what is to come for every sector of the organization. That is, when you are doing strategic planning, you plan what will go to every sector of the organization. We have the organogram of the organization. So what will go to each sector? So you have to plan for it. Then taking into consideration foreseeable changes for all departments. The importance is also seen when looking at an organization productivity. Most institutions believe as possible. Taking a closer look at productivity can provide insight as to where improvement can be made and more specific plans can be set. Some of the key areas that a hospital strategic plan can improve significantly. So these are some of the vital key areas whereby you can improve the strategic plan of a hospital setting for optimum service delivery. One, we talk about risk management, so you can improve on that aspect. Then company culture, service line decision, then goals and objectives of the organization, then capital planning, cost accounting, long range forecasting, operating budgeting. So these are the 8 factors as far as that is concerned. We now talk to the second type of planning, which is the operational planning. Operational planning is the process of planning strategic goals and objectives to technical goals, and objectives to technical goals. At least when you are making strategic planning, put together with objectives to technical goals. So these are two different things. So they now say they link the strategic plan with the activities of the organization. So when you are making strategic plan, you have to put together the activities of
Hello everyone, please you're so sorry for the delay. The lecturer's time is up. I know you could not really do anything, but hopefully next week I'll try and make sure I get the handout sent across to you. So sorry for the delay. Thank you. Goodbye and stay safe.